Can men get breast reductions? Absolutely, they can. There's a medical condition called gynecomastia, which essentially means male breasts. And why would men get this? Well, let's look back a little bit. The breast on a human is composed of both fatty tissue and breast tissue. In women, most of the breast is composed of breast tissue. And in men that don't have any breasts per se, but have very flat chests, they have very little breast tissue and very little fat. If someone were to gain a lot of weight, not only would their entire body look larger, but their chest or their breast would look larger as well. So when we look at a man that has breasts, so to speak, we have to look at what the breasts are composed of. If someone is very heavy and they gain a lot of weight, there'll be fatty tissue in the breast, and that is simple fat that's in the breast tissue. However, there are men that are very physically fit, aren't overweight, but have male breasts. And the reason for that is because of male breast tissue. And it's the same breast tissue that occurs in women. Now, the reasons for it are different. Sometimes it's hormonally based. There may be too much estrogen, which is predominantly a female hormone, but men have more of it and causes them to grow breast tissue, or it could be from certain side effects of some medications. Even marijuana can cause it. We have to evaluate the man to determine what is the cause of the breast tissue. However, there's no cause for it and there's excess tissue. How do we treat it? If it's simply fatty tissue, we always recommend diet and exercise, but if that's not working, liposuction works very well to remove that excess fatty tissue. What do we do in the men that have excess breast tissue? Losing weight's not going to remove that tissue. So what do? We have to remove that tissue surgically. The procedure is also known as a mastectomy. Now, before you think, isn't that what women get when they get breast cancer? The answer is yes, but mastectomy simply means removal of breast tissue. So if we're treating gynecomastia on a male, they will undergo a mastectomy. Now, we're removing just the breast tissue that they have there. We're leaving a little bit of breast tissue because that is normal. All men have breast tissue, which is why men can get breast cancer. 1% of breast cancers do occur in men. So we remove the excess breast tissue and remove the excess fatty tissue. That will result in a man having a very flat chest. Now, what do we do if there's a lot of extra skin? If there is so much extra skin that I feel it's not going to shrink by itself, either from the surgery or with some energy-based device to shrink the skin afterwards, I have to do formal breast lifting, and that removes some of the extra skin that's associated with the male breast. So what can be done for these men really just depends what is causing the condition and what they look like on the physical exam. So if you feel you suffer from gynecomastia, I'm happy to see you here at Park Avenue Plastic Surgery and discuss some of the surgical options for you.